welcome to Med Madness. Today we're diving into the complex world of burn injuries, their classification, immediate physiological responses, and the intricate healing processes. Let's begin with a case study. Imagine you are in the emergency room when a 25-year-old woman comes in with a painful red area on her arm. She reports accidentally touching a hot pan 5 minutes ago. The affected area shows erythema that blanches with pressure and no blistering. What type of burn injury has she likely sustained? If you guessed a superficial burn, you're right. Now, let's explore why this is the case and delve deeper into the fascinating pathophysiology of burns. Burn wounds are primarily classified based on the depth of tissue damage. Superficial burns damage only the epidermis. Superficial partial thickness burns affect both the epidermis and the upper layers of the dermis. Deep partial thickness burns extend through the epidermis and most of the dermis. Full thickness burns penetrate through the entire dermis and can reach the fat, muscle, or even bone. In our case, the patient's burn, which blanches without blistering, is indicative of a superficial burn affecting only the epidermis. The erythema, or redness, results from the dilation of superficial skin capillaries, a direct outcome of histamine and other mediators released by mast cells immediately following the burn. Now, what happens in deeper burns, like superficial partial thickness burns? These involve the formation of blisters. The damage extends to the dermal structures, impacting nerve endings and venules. Injury to venules can cause fluid to leak through gaps in the endothelial cells, leading to fluid accumulation under the epidermis to form blisters. Healing from burns is a dynamic and multifaceted process. Key players in this process are platelets and neutrophils, which release prostaglandins, cytokines, and growth factors. These substances enhance blood flow, promote inflammation, and stimulate the regeneration of tissues. Platelet-derived growth factor, or PDGF, is particularly important, fostering the proliferation necessary for effective wound healing. So, returning to our case, the patient has a superficial burn. Initial treatment focuses on cooling the burn and managing pain, ensuring quick and effective healing. That's all for today's episode. How do you approach teaching about burn management, or what experiences have you had with treating burns? Share your thoughts and stories with us in the comments below, or send us a message. We love hearing from our listeners. Thank you for tuning in. Please like, share, subscribe, and visit medmadness.co to buy the full immunology course.